We will now have Dr. Clare Huppatz, who is the Acting Director at CDCD. She will be giving the Director's address, followed by the awards presentation.
Good morning, everyone. So hello and welcome to everyone. It's so fantastic to see such a great turnout. My name is Clare Huppatz. I'm the Acting Director of Communicable Disease Control Directorate in Paul Armstrong's 6-month absence. So our usual director is on long service leave for 6 months, comes back mid-January. So the team has been putting up with me. It's wonderful to see so many people here today from near and far. I can see colleagues from way up north, which is great, and then people from a wide variety of organisations. So thank you very much for making the effort to come. The team puts so much effort into a day like this, so it's really great to have your support in coming. So thank you. So in terms of a director's update, I've just been asked to provide a bit of a high-level overview of what CDCD does, which will bore the people from the public health units to tears, but we're just conscious that there might be some people in the audience that aren't as familiar with our work. So I'll go over that and then also just a bit of an update on what the immunisation team is specifically up to. Before I start, I would like to acknowledge that we're on Aboriginal land and acknowledge the Whadjuk people of the Noongar Nation and pay my respects to elders past, present and emerging. So this figure is from a governance document, and the top bit has been cut off, but Communicable Disease Control Directorate sits within the Public and Aboriginal Health Division, which sits within the Department of Health, led by the Director General. So above this, there is actually another couple of boxes that says Department of Health Director General. Then there's the Public and Aboriginal Health Division, which includes Communicable Disease Control Directorate. So the CDCD team comprises of the Director and the Support Office for the Director. Now, this is new to the public health colleagues in the audience. We have a new team, the Data Support and System, or Data Systems and Support team, still working through the title. At the moment, it's a bit of a virtual team. We have a consultant working with us to help formulate what that team will look like and how it will interact with the other teams. But basically, it will provide support for data coming into CDCD and do some wrangling of data before the epidemiologist can analyse the data. We've got the immunisation program, infection prevention policy and surveillance program, sexual health and bloodborne virus program, and surveillance and disease control. So what do we do? Broadly, it's about strategies, guidelines, and risk management, compliance monitoring, planning and coordination, surveillance, evaluation, reporting, and disease control, immunisation and outbreak response. Generally, CDCD do more of the policy governance strategy side of things. We're less operational. The operational part of the public health disease response goes to the public health units, of which there's one in Metro and then the regional public health units. So we work under the Public Health Act as well as mandatory policy frameworks. We receive with great gratitude some external expertise from various advisory committees. We sit on national committees and ensure that we're up to date and sort of in keeping with jurisdictional colleagues and what other jurisdictions do. We've got our key stakeholders, all of you in the room, as well as researchers, some of you in the room, and the community that we try and be responsive to. So that sort of input, those inputs go into the team to help us do our work. That's what that's supposed to show. Now, for anyone that's interested, the team has put together the Communicable Disease Control Directorate Strategy 23-26, a bit hot off the press, so it's available online if you're interested to download, and there's more information about the directorate. So this is from that. I won't go through that, but you can read all about it in our strategy. The immunisation program, so broadly, and you might have heard this already when Joanne spoke, the immunisation program within the CDCD supports the implementation of the National Immunisation Program. It supports or works with stakeholders, particularly around improving Aboriginal immunisation coverage. It's also true that if there are other cohorts and vulnerable groups, to increase their immunisation coverage as well. We work to increase awareness of vaccination, preventable diseases and immunisation for providers and also the public. So there's a lot of comms that goes on. We monitor vaccination coverage, safety and effectiveness. Quite recently, the effectiveness has been monitored using some different data techniques, which has been very interesting, linking data and sort of looking at hospitalisations after vaccination and things. So we've got quite an active program there. And we coordinate vaccination procurement, storage and distribution. So in terms of the priorities for the current financial year and into next year, we're currently in a bit of a transition period where we've come off COVID. During COVID, the immunisation team was vast, the team that implemented the COVID-19 vaccination, massive team, massive effort, as well as then there was the CDCD team doing the regular work, business as usual work. That's all sort of been condensed down, and the business as usual work, of course, now has to incorporate COVID-19 vaccination. A few other things it also has to incorporate, which has been presented some interesting, I want to say challenges, but opportunities more than challenges, I would say. So on the back of COVID, we also have a community and a government that is very interested in vaccination, more so than it ever has been. Although some of the community, I think, are more interested in avoiding vaccination now than they previously were, because they've just feel like they've been a bit too vaccinated lately. So we've got some interesting things that have happened there. We've got a bit of vaccine hesitancy that's playing out in some of the lower vaccination rates. You'd know the influenza rates last season were quite low in comparison to particularly the previous 2 seasons, as everyone was scared they'd get flu and or COVID together. So we've got that. We've got a government that's suddenly really interested in vaccination, because they watched with great interest what we could do when asked in terms of vaccinating the community for COVID, a threat that was upon us. So now they're saying, well, what are the other threats? What are you doing? What are the rates? Suddenly they're really interested, which is great and presents a great opportunity for the team here. But it just means they're super busy as well, because we get flooded with questions from a very high level. What are we doing this? Why aren't we doing something about meningococcal B vaccination for WA? So we've got to manage that. Why aren't we doing something about RSV and looking at nirsevimab as a potential drug to implement? So a lot more interest than we ever used to have, which just does present opportunities and makes the team really busy. Then, as also coming on the back of COVID, we've got to stabilise our workforce. So there are some positions advertised at the moment within the team. Bit of a plug, it's a fantastic team to work for. Everyone's super happy, and it's a great directorate. So have a look at those. They're not closed yet, are they? No, not closed yet. We've got Vaccinate WA, our vaccination management system, which was purchased during COVID for COVID, but of course we've still got it. We're currently using it for the school-based immunisation program. Hasn't been perfect for that. We are working on improving that, absolutely. And also, I think we need to look at that as a system, given that we have it, what else it can do and whether or not it can be expanded. But certainly we need to optimise that. We're starting to work on the WA Health Influenza Vaccination Program for 2024. Bigger and better is the message. This is something that's going to be sponsored from a very high level. Health Minister's very interested in ensuring that the whole community gets vaccinated. So I think that's our charter for next year, is really making sure target groups, vulnerable groups are really targeted, but also that vaccines really broadly available and everyone gets vaccinated. The pharmacy expansion program. So as you're aware, and some of you may be from or work in pharmacies in the room, very happily, pharmacies have been brought on board to provide vaccination. It really made a huge difference in COVID, and hopefully it will make a huge difference for the NIP program as pharmacists get more engaged in vaccination, and for the community just presents another avenue and increases access, which is fantastic. The WA Immunisation Strategy 24-28. So the team has been working towards that. It's not finalised yet, but will be by the end of the year. I'm right in that? Early next year, sorry. So that's been a big piece of work, and I know consultation, again, people in the room have contributed to that, so thank you. I'll just do a time check. Oh, we're okay. One thing that I just did want to mention was the GEV program. It's not anywhere else on the agenda, so I'm just going to sneak in a few slides if that's okay, so that you're aware. Japanese encephalitis vaccination program has been rolled out over the last, let's say, 18 months. It's not quite, it's about 18 months actually, so since May of last year. As you would know, Japanese encephalitis virus, mosquito-borne virus, there have been no active cases in humans, but it has certainly been found in host animals. So we've found evidence that in WA, pigs and sentinel chickens in northern WA have had prior exposure to GEV. So there's been a massive program of work between CDCD and Environmental Health Directorate here in the department, but also with Department of Agriculture colleagues, the Chief Vet, and public health units on the ground in the Pilbara and the Kimberley to start a immunisation program to provide vaccination to people who are at risk of Japanese encephalitis. So that's going on in the Kimberley and the Pilbara at the moment. Since May, when it began, 6,653 Japanese encephalitis vaccine doses have been administered. A little graph there showing that majority are in the age group around the 30 to 50, which is that working age group, but you can see it extends out to between 10 and less than 70. And that just shows where who the sort of the timescale. I don't know if this has got a pointer. Anyway, the timescale over which it's been the vaccine program has been rolled out. It is still going on, and then who's been doing the vaccines. So just thought I'd sneak that in. And I think next we've got the immunisation awards. But before we go to that, are there any questions for me?